Despite all the efforts to treat and cure lung cancer, it remains the leading cause of cancer-related death in the U.S. That's more than breast, colon, and prostate cancers combined. Yet there's one advancement that's offering a significantly higher chance at survival by reducing the chance of recurrence. So here's more in a segment sponsored by the Lung Cancer Foundation of America. And I am happy to welcome to the show thoracic surgeon Dr. Jonathan Villena Vargas. We also have lung cancer survivor Lisa Goldman. Thank you both for being with me.
Thanks for having us.
Thank you.
All right, doctor, I want you to first explain kind of the concept we're talking about today, which is adjuvant therapy. How is this providing new hope? We're talking about lung cancer patients specifically.
In the last 5 years, there's been a paradigm shift in how we treat lung cancer. It used to be that, we could only give surgery and chemotherapy, but now two new different types of treatments are available for patients, either using the body's own immune system or something called immunotherapy, or attacking a specific cancer mutation or something that we call targeted therapy.
And so what is the difference between these therapies? Why is this a big deal that there are new treatments out there?
So it's a big deal because cancer after surgery comes back. And what we've seen is that this new type of therapy, especially immunotherapy, it actually prevents cancers from ever coming back. And even in stage 4 patients can cure patients. And this is something that's completely new. And it's very different than what we used to treat cancers in the past. In addition, targeted therapy, understanding the cancer's specific mutation, is able to allow us to target that mutation and has really, really good outcome.
Okay, that is wonderful to hear. Lisa, I want to talk to you about your story now. Share with us when you learned you were diagnosed.
I learned I was diagnosed over a decade ago. I was 41 years old, and I had a persistent cough that wouldn't go away, but I never dreamt that it was lung cancer, and neither did my doctor because I had no known risk factors. So I went for months with this, testing out whether I had asthma or allergies, and finally we did a chest CT, and soon after I was diagnosed with stage 4 lung cancer. Immediately after that, I was put on traditional chemotherapy because this was a decade ago, and I was given a prognosis of 9 months to live. But very luckily, I was tested for a biomarker, which made me eligible for this targeted therapy drug. It's an oral pill I take twice a day, and I've been doing that for over 10 years now. I've just been so fortunate to be an exceptional responder to this medication.
Oh, that's incredible. And really, clinical trials, the research behind them, like all of this is what made that possible. So do you have any advice really for patients out there to consider taking part? I know a lot of people can be nervous, have some anxiety about that.
Absolutely. It's totally understandable to be nervous about it, but the truth is that clinical trials are tomorrow's medication available today. And I've seen so many patients achieve great results through clinical trials, extending their life by months and years beyond what would have normally been expected. So I think clinical trials are a great resource for cancer patients, and should my medications stop working for me, I will definitely be the first in line looking for a clinical trial to join and hopefully benefit from.
Absolutely. All right, doctor, so as we go back and talk about who this is available for, if somebody is out there, going through treatment for lung cancer, is this something they should talk to their doctor about, to their oncologist?
Absolutely. The way we treat lung cancer has changed so much in the last 4 or 5 years, and now we are treating every stage 1, 2, 3, and 4 of lung cancer with these new medications and drugs and treatment paradigms. So if you have a diagnosis of lung cancer, you should be speaking with your doctor to see if you're a candidate.
All right, I want to send our viewers today then to lcfamerica.org to learn more about the research and to donate, of course, to the Lung Cancer Foundation. Thank you so much.
Thanks for having us.
Thank you.
Well,